we work with a place called Keystone Migrant Health. The class has to be in the fall because apple harvest is in the fall. We go out to where the people who are picking the apples live, and we knock on their door and we interrupt their supper, and we are there with a nurse generally and a professional interpreter and my students and sometimes me, and we take medical histories. We ask people what diseases they've had, what conditions they've had, if they have any current conditions. If they have current conditions, some students, once they get used to it, once they get up to speed, also serve as interpreters for the nurses, asking people questions. You know, my goal is to break down the walls of the classroom, get things out in the world, because I was that way as a college student. I wanted to think that all the stuff I was working so hard on related to something in the world, right? And I think students are starved for that.
Well, I thought it was a great experience because I felt that, especially being in Dickinson, where I believe, which is why I chose Dickinson, like the philosophy of engaging the world. Well, I thought you should start in a micro level, and it's engaging the community. And so the class, I believe, that allowed you to take the knowledge that you have in the classroom and take it outside and help those who are really in need. And I felt like I was a significant member of the community because my role was very important, and I was able to relieve these people by just translating.
I think service learning is a tool that can give students a direct motivation for why it is they need to work hard. Right? This is something you will need. This is something you need to know. I take a student out to Adams County, and they've been studying Spanish for healthcare. Right? They've been studying parts of the body, and they've been studying all that stuff. The amount that student's going to remember what they said in Spanish or what was said to them in Spanish, and the pressure that student puts on themselves to learn the correct Spanish in that situation is about 10 times more than they're going to do on a test that I give them in class, right? So it works. It's a powerful tool. In many ways, the community partners are very flattered that there's somebody in the academy, in the academic world, who's interested in the problems they face, who's trying to train new people to face these same problems, and has some sympathy and knowledge base for what goes on. And I learned we actually are having a pretty significant contribution just recently because the woman from Keystone called me and said, I'm filling up my budget for next year, and I need to know if I have your students working that part of the year. So we're needed. You know, we're getting something done.
I wanted to learn more medical terms just in case if I do become a doctor, then I would be able to perfect, like I said, both languages and be able to, if I had a patient who just spoke Spanish, I would be able to speak with them fluently. But also, I think another way was to understand the cultural barriers that there are and also the health problems. So it helped me understand basically how the health system works, and now I have a better knowledge of how that field works, and it would enhance, I think, my knowledge, not just knowing the science department of medicine, but as well as the philosophy of what's out there and knowing what to do that will help my patients better.